Welcome back. 1 out of every 100 babies will be born with a congenital heart defect. This week is Congenital Heart Awareness Week, and joining us now is Dr. Heather Sowinski. She's pediatric cardiologist at Helen DeVos Children's Hospital to talk more about this very important topic. Doctor, thank you so much for being with us.
Of course, thank you for having me.
So tell us a little bit about what you do. We were talking a little bit about off camera, but obviously 1 in 100 is a staggering number.
It is. So congenital heart defects is the most common birth defect that we see. So the fetal heart is actually fully formed at 8 weeks. So very early in pregnancy, this occurs. And fortunately, thanks to technology, now we have the ability to look at the heart in detail during pregnancy and come up with a plan.
Yeah. And so is this something that you guys look at immediately with every mom? You're looking at this baby's heart, and then there are things that you're looking for? Yeah.
Correct. Okay. So at any mom that's pregnant, when they have their anatomy scan, there's kind of a set of check boxes of what the OB needs to see. If there's any concerns based on what they see, then they'll send them on to have a dedicated fetal echo where we look at the heart in detail and we're able to tease out everything.
Okay. And so say something happens and you find something, how do you proceed from there?
So during pregnancy, if the fetal heart's fully formed at 8 weeks, but at 20 weeks when we look at the heart, we can't change anything, but it's more of the planning, making sure that everyone that needs to be there when that baby is born is there, and so that we don't miss a step.
Absolutely. And so how beneficial is it for you to have that knowledge before this baby, so long before this baby is ever born, so that even like moms and dads and everyone's prepared and knowing what's going on when that baby's born?
I think it's vital, really. And fortunately, most of our babies with congenital heart defects come out kicking, screaming, doing all the things we would expect them to do. Every once in a while they don't. And then if we don't know ahead of time, it's a whole new diagnosis for a family that the rug kind of pulled out from under them. If we know about it at 20 weeks, then we have a potentially 20 weeks to talk about it and come up with a plan and educate the family so that when that baby is born, they already know what to expect.
Absolutely. I mean, yeah, it's not a time you want to be surprised by anything.
Yes, exactly.
Right?
Yeah.
And you say, the outcomes are great. So many times these kids don't even need surgery. They're just, as you said, kicking and screaming the minute they come out. Mm-hmm. So tell us about that.
Yeah, so fortunately, the majority of kids, although it's 1 in 100, not everyone's going to need open heart surgery or some kind of intervention to fix their heart abnormality. Even those that do, majority of them do very well lifelong with very little limitations.
Absolutely. And so this is something, though, that moms need to be aware of when they're going to see their doctor, too, that this is something that the doctor should be looking for.
Absolutely. So, again, there's those check boxes that every mom should have to make sure that there is no concern. And then there's a subset of population that carries a slightly higher risk. So those moms automatically would be scheduled for a fetal echocardiogram. Okay. So.
Okay, perfect. And their doctor would know that.
Yes.
All right,
correct.
And send them for that. So tell me about what you love so much about your job and what you do.
My job is wonderful. I have the privilege of working with some amazing families, and being a fetal cardiologist, I get to be there from the beginning. I get to be there when the family learns of the diagnosis, help them process all of that, and then get to see when that baby is born and see them through their surgery and to the end, which is a wonderful experience to be a part of.
Absolutely. It can be a very scary time for a parent. You're just so positive and you give that off that you're there for them, and then you're going to help that baby thrive.
Yeah, and that is what I love. Educating them, making it not as scary, and getting to celebrate the good times and bad.
Wonderful. Well, Doctor, thank you so much for being with us. If people want more information about what you do and about your department, what do they need to do?
Just go on the Helen DeVos website. There's a section for cardiology, and the Congenital Heart Center has all the information you'll need.
Oh, perfect. Well, thank you so much for all you do. We appreciate you.